Urgent question, Heidi Alexander.
To ask the Secretary of State for Health if he will make a statement on what steps are being taken to improve the financial position of NHS trusts.
Minister Ben Gummer.
Thank you, Mr. Speaker. The House will know that in 2014 the NHS itself set out its plans for the next 5 years, which included a front-loaded funding requirement of £8 billion. Because of our strong economy, this government has been able to honour that request and will be funding it in full, including a down payment of £2 billion in this financial year, ahead of the spending review period. Next year, there will be an increase of £3.8 billion, and taken together, we shall therefore be providing £10 billion towards the NHS 5-year forward view. Within that context, there are a number of hospital trusts who are running a financial deficit, in large part because of the need to staff wards safely after what was learned in the aftermath of the scandal of mid-staffs. It is also the case that the best hospitals have begun to transform along the lines required by the NHS 5-year forward view, but some have not, and this has made the management of their finances all the more difficult. NHS Improvement expects that NHS hospital trusts will report an overall deficit for the current financial year, 2015-16. Savings achieved in the rest of the NHS have ensured that this overall deficit will be offset, so that the system as a whole will achieve financial balance. For the next financial year, NHS Improvement will continue to work with trusts to ensure that they improve their financial position. To help them in this endeavour, the Department has introduced tough controls on the costs of staff agencies, a cap on consultancy contracts, and introduced central procurement rules as proposed by Lord Carter in his review on improving hospital efficiency. The House should note that the savings identified by Lord Carter come in total to £5 billion a year by 2020. The Chief Executive of NHS Improvement, Jim Mackey, is confident that taken together, these measures will enable hospital trusts to recover a sustainable financial position next year.
Heidi Alexander.
Thank you, Mr. Speaker. I'm afraid the Minister seems to be in a state of denial. He claims the settlement secured by the Department of Health in the spending review will sort the financial pressures hospitals are under, but he either doesn't understand the scale of the problem or he simply has his head in the sand. Mr. Speaker, in the last few weeks, it has become abundantly clear that hospitals across the country are buckling under the strain of providing healthcare with an inadequate budget. 4 out of 5 hospitals are now predicting a deficit. Monitor are reportedly assembling teams of management consultants to dispatch to up to 25 trusts in need of turnaround, and now we learn that along with the TDA, they have written to every hospital asking them to take urgent steps to regain control of their budgets, including, and I quote, headcount reductions additional to the current plan. Was the Minister or Secretary of State aware that this letter had been sent, and did it receive ministerial approval? How many hospitals have subsequently had meetings to discuss headcount reductions, and how many job cuts have been agreed as a result of these meetings? Mr. Speaker, we now have a situation where, on the one hand, the Care Quality Commission is telling hospitals they are unsafe, and on the other, Monitor is telling them to cut staff. So which one is it, Minister? What proportion of these so-called headcount reductions will involve clinically trained staff? On Saturday, the King's Fund said this: 3 years on from Robert Francis's report into mid-staffs, which emphasises that safe staffing was key to maintaining quality of care, the financial meltdown in the NHS now means that the policy is being abandoned for hospitals that have run out of money. Will the Minister now accept that his government's financial mismanagement of the NHS has made it impossible for some hospitals to provide safe patient care? Is it not the case that this government has fundamentally lost control of NHS finances? And isn't it now clear that the only way ministers are going to make their planned £22 billion worth of efficiency savings will be to cut staff, cut pay and close services. I say to the Minister, it's time to stop the NHS doublespeak and just come clean.
Thank you, Mr. Speaker. I thank the Honourable Lady for asking this urgent question. And she started off by claiming that the Secretary of State and I were in a state of denial. But all I'd say to her is that were she to look at the actual outcomes of the NHS this year, compared with the last year of when her party was in power, she might consider that actually the performance of the NHS has improved beyond measure. It is not only the fact that we have 1.9 million more A&E attendances, 1.3 million more operations, 7.8 million more outpatient appointments, and 4.7 million more diagnostic tests. This is an NHS which is performing more procedures, helping more patients, doing more for the people of this country than at any time since its foundation. So I would suggest to her gently that the party and the person who is in denial is her own and her own standing in front of the service, working hard to try and deliver better patient care in what is a challenging environment. Now, she asked a number of subsequent questions about staffing levels and about letters sent out by NHS Improvement, and I will endeavour to ask each of them in turn. She asked about the settlement that the Treasury has made with the NHS, and I would point out to her at this stage that it is precisely the settlement that the NHS itself asked for. That's right. And it is exactly that settlement which the party opposite refused to endorse at the last election. The second question or statement that she proposed was that there were teams of management consultants, which allows me to remind her that the numbers of management consultants has been cut very considerably by the previous government and by this, in contrast to that of the party opposite, who increased the numbers of managers in the 13 years that they were in power. But we will make no apology for the fact that NHS Improvement and its constituent bodies is working very hard with some of the most challenged providers to help turn them round, to try and address the issues of efficiency and quality that they all have. Now, is she suggesting that somehow they should not be doing that? Should they not be going round hospitals trying to help those which are not able to control their own finances? Should they not be doing what is needed to try and improve the quality of care that they provide? Because if that is her suggestion, it is a quite remarkable one, and one that I think that should be more widely shared with the people that she seeks to represent. She talked about the letter sent out by NHS Improvement. Yes, the department was aware of it, as it was of the letter sent out on the same day by Professor Sir Mike Richards of the Care Quality Commission, addressing the issues of quality that need to be seen across the service. And I know that this is news to the members on the opposite benches, but there are not separate parts of the NHS issuing separate diktats. The letters issued on staffing and other issues in the last few months have been co-signed by Professor Sir Mike Richards, the Chief Inspector of Hospitals, by Dr Mike Durkin, the Director of Safety at NHS England, and by Jim Mackey, the Chief Executive of NHS Improvement, and indeed by Simon Stevens, the Chief Executive of NHS England. This is one system addressing the particular problems which are evident in some challenged providers and making sure that they level up to the best. And if she is not convinced of that, she should look at the co-signatories on those letters and see how they correspond one with the other. She asked about the line in one of the letters about reductions in headcount, and I again will point her to the reductions in headcount in administrators that have been achieved by this government over the previous 5 years. We have managed to reduce by some 24,000 the number of administrators in the NHS, whilst at the same time increasing the number of clinicians by 16,000. So would she, on the one hand, whilst not promising the money to the NHS that the NHS has asked for, ask it to maintain the same level of administrators in the years ahead, or would she back NHS Improvement's plan to find efficiencies in the NHS, across the NHS, precisely so the money that is spent on administrators can be spent better on clinicians and increase the number of clinicians and in directing resources to the front line? I know the Honourable Lady is earnest in what she says about the NHS, but I cannot believe that she is really riding out in defence of increasing spend in back office at the expense of the front line. She asks about the safe staffing ratios, and she made a number of statements which I think that in retrospect she might feel were somewhat irresponsible. And the reason for that is that the letter issued in October of last year on the issue of safe staffing, building on the advice given by NICE, was co-signed by Professor Sir Mike Richards, the Chief Inspector of Hospitals, and by NHS Improvement and the two constituent bodies of it. It was a co-signed letter because the delivery of quality and efficiency are two sides of the same coin. Those hospitals that are providing the highest quality of care in this country tend to be those which are also in control of their finances. And likewise, those which are struggling with quality also tend to be those that cannot control their own finances. And if she were to suggest that somehow there is a binary distinction between the two, a choice to be made between quality and efficiency, I would gently say to her that she is about a decade behind all current thinking on how you run a successful health service, making sure that quality and efficiency go hand in hand, and that is why the very best hospitals can do both. So in all of this, I would say to the Honourable Lady that she should avoid falling into the trap that her predecessor so often did, of assuming that there is some trade-off between quality and efficiency, and of attempting a pretty kind of low-level politicising of the NHS, an approach that was so roundly rejected at the last election. And I would ask her to consider the counterfactual, that were she standing here at this point, having won possibly the last election, she would not have had the £8 billion to invest in the NHS that we have managed to do, and she would not therefore be able to assure the public of continued improvements in the number of patients treated, an increase in the number of operations, a number of GPs in excess of 5,000 that we have promised to deliver by 2020, record numbers of A&E admittances and record numbers of outpatient appointments. None of that she would have been able to promise, and that is why on this side of the House we are proud to reaffirm that it is us who are the true party of the NHS.
Dr. Sarah Wollaston.
Thank you, Mr. Speaker. We all welcome the front-loading of the NHS settlement and also want to congratulate NHS staff for the extraordinary efforts they're putting in to improve quality alongside coping with rising demand. Can I ask the Minister that if NHS Improvement are tasking management consultants to come in and advise trusts to turn around financial problems, will he also task them to look specifically at the issues of social care and how the interrelation between underfunding and social care impacts on health economies of local trusts, and also to look at improvement and prevention, because both prevention and was also noted by Simon Stevens to be unfinished business from the spending review.
Well, the Honourable Lady will be aware of the increase in the Better Care Fund that this government has introduced and the 2% precept on council tax bills, which will deliver increases for social care. But she will also be aware that the 5-year forward view is a holistic understanding of the healthcare system in this country and includes transformation of the NHS and social care towards that point. And that is why we are proud to be funding the 5-year forward view in the manner in which Simon Stevens has asked, front-loaded, £3.8 billion next year. And it is the manner of that integration, bottom-up integration over the next few years, that will ensure that the challenge she identifies around social care will be addressed in the years to come.
Philippa Whitford.
Thank you, Mr. Speaker. I'm not sure with almost 80% of trusts running a deficit that we can just say that it is failing hospitals that are having problems. While the government talks about giving £10 billion up front, 2.2 of that is already written off in the deficit, and normally budgets are described across Department of Health, whereas Public Health and Health Education England are all losing money. So it is described that with the £3 billion being clawed back from the areas that are not specifically NHS England, it's actually £4.5 billion and not £8 billion being put in. Now, 5-year forward identified public health and prevention as crucial. The government has a plan to recruit 5,000 extra GPs. I'm not sure how that can be done without Health Education England. And the one thing that has so far been shown in evidence to impact on unnecessary deaths is a good, strong ratio of registered nurses to patients. And I think that it is important that we look at how that will be funded. Trusts are not allowed agency, they're not allowed immigrant nurses. How are they going to do that? Why don't we get NICE to finish the piece of work on safe nursing levels throughout hospitals?
Well, I thank the Honourable Lady who has asked some salient questions. To address them in turn, she asked about the deficits across the system. It is true that there are some particularly challenged providers where the heaviest deficits fall, and they account for the larger part of the accumulated deficit. But across the system, it's been a very challenging time. Not only the demographic challenges which face the NHS have got worse every year in the course of this and the last Parliament, but also because of the effect of the excessive charges of agencies levelled after the increase in staffing levels in the wake of mid-staffs. And it's to seek to address that, which makes up the majority of the cost of the deficit, that we have brought in the controls on agency spend, on locums, but also on very high salaries and on consultancy spend. Taken together, that will make a significant difference to hospital trust finances. She talked about public health, and we accept that it's a very important part of achieving the 5-year forward view. And that's why over the course of this Parliament, we will be investing £16 billion in public health across England to ensure that we can achieve the kind of transformation that she wishes to see. On the recruitment of GPs, we do intend to have 5,000 additional GPs by the end of this Parliament, and I'm glad to say that Health Education England is so far as meeting its targets in filling those training places, and I should congratulate Professor Ian Cumming, the Chief Executive, for the work that he has done in doing that. And she talks about safe staffing and the NICE guidelines. What became clear in the process of NICE looking at safe staffing levels was that, as the chief nurse identified, we need to look more broadly at the team staffing levels and not just at individual positions within wards. I think she will understand that particularly. And that's why the chief nurse and Dr. Mike Durkin were commissioned together to look and build on the advice of NICE. And the safe staffing guidance that comes out in the next few months, I think, will show a broader and more complex understanding of staffing levels, one that I know that she will appreciate from her time on the wards. But to be very clear, that staffing guidance will only be signed off once it has the approval of NICE, of Professor Sir Mike Richards, the CQC, and also of Dr. Mike Durkin, the Head of Safety and Quality at NHS England. So it will require the imprimatur when it comes in.
Jeremy Lefroy.
Mr. Speaker, our experience in Staffordshire is that it takes a medium to long-term plan to put things right, and I really pay tribute to the work of the staff at the Stafford's County Hospital and the Royal Stoke Hospital. Will you assure me that any measures put in place, both in Staffordshire and across the country, will take a long-term view and not be driven by the need to cut costs within a financial year? A 4-5-year plan is vital at the very least.
Well, I could not agree more with my honourable friend. It is important to take a long-term view, something that's bedevilled the NHS under all kinds of administrations since its creation. It is for the first time able to see a 5-year forward view, and that means that it can begin to transform properly. The very best trusts in the country, like that at Northumbria, previously run by Jim Mackey, was able to do that. And what we want to do is to bring that kind of excellence to hospitals across England to ensure that they provide the kind of sustainable staffing levels and sustainable quality levels that I know that he is beginning to see at mid-staffs after the long-term view that's been taken in that hospital.
Mr. Ben Bradshaw.
Devon NHS had no deficit in 2010 when we had a Labour government. It's now the worst deficit in England. What assurances can he give my constituents in Exeter and elsewhere in Devon that services and waiting times won't deteriorate even further?
I thank the honourable gentleman. I thank him for his right honourable gentleman, and I thank him for his cooperation and help in trying to form the future of the NHS in Devon. This will only work if it's a cross-party effort, as it is on a national level. We have particular problems in Devon. They are really very urgent, and it will mean that the deficit increases unless we take significant local action. But that action needs to be led by local clinicians, and I'm very glad that they are talking constructively together. My job, as his, is to provide support to that in the coming months so that we have one plan and then we implement it.
Creasy.
Thank you, Mr. Speaker. Let me try to give the Minister an example from my constituency of where some of these challenges are making real for patients. My local hospital, Whipps Cross, ended up downgrading the nursing bands in an attempt to save money, and as a result now has a big crisis in staff morale. The CQC has intervened because of the quality of care, and a massive agency bill. Now, Whipps Cross Hospital is also part of Bart's NHS Trust. Bart's has the largest public finance deal in the country. It's due to pay back £7 billion on a £1 billion loan. And that trust paid out £148 million last year alone on its PFI deal, of which half was the interest that it paid. So can I ask the Minister very directly, what is he doing to help trusts renegotiate these costs and tackle these legal loan sharks of the public sector?
I thank the honourable lady. It's a brave line of attack to go on PFIs signed by the previous government. But all I would say is that I've held quite a number of meetings now with her colleagues on BARTS. I completely understand the difficult position that she and her colleagues find herself in, and indeed the Trust. I had a meeting this morning about BARTS. I had 2 last week, and I shall be having a further 2 this week and next, precisely because I want to see the transformation that she needs in her area. And I'm very happy to discuss that in greater detail with her. And in fact, we'll be convening a meeting of local MPs in the near future.
Waitley.
Thank you, Mr. Speaker. The government rightly front-loaded the extra money the NHS called for in the 5-year forward view, but it's vital that money is used to drive transformation, the productivity improvement that's needed, the shift of care out of hospitals and so on. Could my honourable friend assure me that money will not go just to plug deficits, but to change the way services are delivered as is needed?
My honourable friend is entirely right and speaks from experience. That is why, as part of the spending review settlement, £1.8 billion was set aside as a transformation fund. And the principle behind the transformation fund is that the money will go to those trusts which are beginning to show transformation in the way that they are not just running their finances, but their whole operations. And that is to the betterment of patients as a whole. We have to see transformation, otherwise money will be wasted, as it has done in years previously.
Keith Vaz.
Speaker, what help and assistance can he give to the ambulance service in Leicester? On Sunday the 24th of this month, 10 ambulances were parked outside A&E at the Royal Infirmary, 10 out of 25 in the whole of Leicestershire, trying to hand over patients to the staff. And on 856 occasions in the last year, there had to be a wait of between 2 and 4 hours to hand over those patients. What we need in Leicester is not more consultants, but a better system of management.
The right honourable gentleman raises issues which have been severe in Leicester, and I'm aware of them. And I'm very happy to have a separate meeting with him to discuss those and what is being done about it. Across the country, we're actually seeing rather better performance this winter than last. That's because of the extraordinary amount of planning that's been put in by the NHS and the fact that we're getting better at dealing with the extraordinary pressures that happen during winter. But in Leicester, there has been a particular issue. I'm aware of it, and I would like to reassure him that it will be fixed in time for next year.
Jason McGartney.
Mr. Speaker, I welcome this urgent question because clinical and patient decision-making in Calderdale and Huddersfield NHS Foundation Trust is being dictated by a catastrophic PFI deal signed in 1998 that will see us paying for Halifax Hospital, which cost £64 million, will eventually cost us, the taxpayer, £773 million. This has led to a proposal to close A&E at Huddersfield Royal Infirmary. Will the Minister please launch an urgent review into these catastrophic PFI deals? And I look forward to exploring this further with him in my Westminster Hall debate tomorrow afternoon.
My honourable friend should know that that review is already taking place within the Department of Health. We are looking once again at the PFI deals which have been signed by a previous administration. They did go around the country at the time claiming to build new hospitals without telling people that they'd all been put on the credit card, one that would be paid by future generations and in part by the NHS itself. It is a great shame, and it's created a great deal of uncertainty for many trusts. I know that he has specific issues in Huddersfield and will be answering them later today in Westminster Hall.
Mr. Norman Lamb.
Thank you, Mr. Speaker. Could the Minister be very clear as to whether he accepts the view of Simon Stevens that if there is a funding gap in social care, as is projected to be the case in 2020 and before, that it will simply increase the deficit in the NHS and that funding of social care remains unfinished business? Does he accept that case?
I accept the case of the 5-year forward view. Simon Stevens was very clear that the relationship between social care and the NHS needs to be transformed. It called for £8 billion additional into the NHS, which we have provided, and it required additional money also for social care, and we provided them the Better Care Fund and the precept from council tax.
Mrs Anne Main.
Thank you very much, Mr Speaker. West Herts Hospital Trust has been struggling for a very long time. Between 1998 and 2010, it registered a deficit for 5 out of 12 years, peaking at 27 million in 05-06. It's struggling as well from a backlog of repairs and maintenance to a very elderly estate through lack of investment under the previous Labour government. What more can be done to help hospital trusts that are struggling with a massive backlog of ongoing maintenance?
My honourable friend is entirely right, and I went to Watford a few weeks ago, and indeed the buildings are in a poor state of repair, and they do not enable clinicians to provide the high standards of care that they all aspire to do, because in many cases it is difficult to do so. West Herts Trust requires additional capital expenditure. I've talked with them there about how they might realise that, and I am doing so within the department at the moment.
Mr Ian Wright.
Thank you very much, Mr Speaker. My constituent contacted me earlier today. She had a scan last Tuesday and was told the following day she required an urgent referral to a gynaecologist within 2 weeks and will be provided with an appointment within 48 hours. That didn't happen. This morning, Mr Speaker, I was told by the NHS there were no appointments available anywhere and no idea when one would be available. My constituent is frantic. The Minister in an earlier response mentioned outcomes and increased appointments, but Minister, this is the reality of the NHS in 2016 for my constituent and millions like her. No funding or staffing available, not just for routine appointments, but for urgent appointments related to cancer. What is the Minister going to do for my constituent, and how quickly will he get a grip to ensure appropriate funding is provided for the NHS?
I say to the honourable gentleman that over the course of the last Parliament and the beginning of this, we have come from being one of the worst performers in terms of cancer outcomes in Europe to roughly midway through the table. And we've done that through rapid improvements in the kind of work that we've been doing with people suffering from cancer. There's a lot more to do. But actually the money is flowing in, improvements to outcomes are happening. But if there are individual cases, I would of course look at them, as I know my honourable friend, the Minister responsible for cancer services, will do, and I'm happy to take it on as a personal case.
Mr Henry Smith.
Thank you, Mr Speaker. Last decade, under the previous Labour government, the healthcare trusts that serve Crawley constituency saw chronic deficits and services closed, such as A&E and maternity at Crawley Hospital. Services are now returning to that location. Can he confirm that this government is investing £10 billion in our NHS over the course of this Parliament? And can he also confirm how much the NHS is being cut in Wales, where Labour, of course, are in control?
Well, I can confirm that the amount of money available to the NHS will increase by £10 billion over the course of this Parliament. But it's not just a case of an infusion of money, it's about concentrating on quality and efficiency across the service. And in Wales, not only has money been cut, but there has not been that concentration on quality and efficiency, and that's why outcomes are so much worse in Wales than they are here in England.
Daniel Zeichner.
Mr Speaker, the hospital that serves my constituency in Cambridge, Addenbrooke's, is one of the trusts with one of the most challenging deficits. And today it is urging people not to attend accident and emergency. And they explain that by saying they're seeing more and more frail elderly patients. At the same time, the Conservatives in Cambridge are refusing to levy the 2% the Chancellor has offered them. We've got a crisis in social care and health funding in Cambridgeshire. How can it possibly help hard-pressed staff at Addenbrooke's to hear this instruction that the numbers should be cut? Can the Minister assure me, patients and staff in Cambridgeshire that that dictate will be withdrawn?
No, I can't assure him that. We will not stop. We will stop trying to find efficiencies across the NHS, because the important thing is to make sure that we are channeling money right to the front line, and that means in his hospital as it does others. And sometimes that will mean finding efficiencies within individual trusts and commissioners and making sure the money is rediverted. I should say to him actually that the problems at Addenbrooke's go much further than A&E. It is a hospital in special measures. There is much to put right there, and I'm confident under the stewardship of the new Chief Executive, who is proving himself to be excellent, that will be managed.
Mr. Andrew Stevenson.
Mr. Speaker, can I ask my honourable friend the Minister to thank the Secretary of State for supporting the calls for extra investment in Burnley General Hospital? The additional £15.6 million committed last year for a Phase 8 development at Burnley General will create a state-of-the-art ophthalmology unit and allow the hospital to centralise all the outpatients in one location. Following on from the £9 million new urgent care centre, this is the latest boost at a local hospital which lost its accident emergency department and other key services under the last Labour government.
But the reality of the fact, as my honourable friend has recounted from his own constituency, is that satisfaction in the NHS is at near record levels, dissatisfaction in the NHS is at record lows, and we rank number one in the Commonwealth rankings of hospital and health systems across the world. And so far from the pictures painted by members opposite, the fact is that people feel the NHS is getting better. And that is why, increasingly, it is proof that it is safe in the hands of the Conservative Party and will continue to be so over the next 5 years.
Nick Dakin.
Mr. Speaker, the health economy in North Lincolnshire has been severely challenged for a number of years. When I meet with the Chief Executive and others of North Lincolnshire and Gould Hospital Trust, I get the impression that they're trying to run up an escalator of finance which is flying down towards them. What can the government do to help in these circumstances?
I recognise the problems identified by the honourable member. There are particular problems in NLAG and in North Lincolnshire. I know that NHS Improvement is looking in detail at them at the moment, and I hope that by working with the existing trusts management, we will be able to see an improvement over the next year. That is the point of what NHS Improvement is trying to do. And just to give him reassurance, if Jim Mackey is able to produce the kind of results that he did in his own hospital trust, then his constituents will see a quality of NHS outcomes which so far I'm afraid that has eluded them.
Van Howlett.
Thank you, Mr. Speaker. I'm afraid to say that I have the great displeasure of seeing firsthand the catastrophe that was NHS Connecting for Health under the previous Labour administration. Therefore, I think it's a little bit rich, I have to admit, to see the Labour frontbench table this urgent question today. Would you agree with me that this government has put in a strong regulatory regime and also in joint investigations between NHS Improvement, CQC and also Monitor will help prevent future contractual failures?
I can give my honourable friend that reassurance, and he should know that every Monday when I meet with leading officials in the NHS, the people in the room are the Care Quality Commission, NHS Improvement, NHS England. We make joint decisions, and that is important because this system has to work as one. Otherwise, if you have different parts pulling in different places, we won't provide the solutions that we need. That has been the case through the history of the NHS. For the first time, actually, we have a system-wide response to the challenges facing this health service.
Rachel Maskell.
Thank you. Mr. Speaker, the CQC is downgrading trusts like the York Teaching Hospital due to the national NHS staffing crisis, and in addition this trust will have an £11 million deficit for the first time at the end of this year. Can I ask the Minister what risk assessment he took around patient safety before the government agreed to endorse NHS Improvement's letter advising trusts to cut headcount?
The Honourable Lady is wrong. The CQC is not downgrading any trust. The CQC provides a very important function in the NHS that did not exist before, which is to give open and transparent accounts of how good quality is in individual trusts. So for the first time, patients are able to see whether their trust is safe, whether it's well led, whether it's effective. And that means that we can actually have a proper and solid response where there are failings. And in too many parts of the NHS, I'm afraid, there is still not the kind of level of quality that other parts already deliver. The CQC shines a light where we need to improve, and our job as part of a system with NHS Improvement is to make those areas measure up.
Diana Johnson.
Speaker, my trust in Hull is predicting a deficit of £21.9 million by the end of the financial year. In light of the CQC report of a few years ago criticising the staffing levels in Hull, I know a huge amount of effort has gone into increasing those staffing levels, but at cost, especially the premium that you have to pay for medical staff. So I wonder if the Minister can reassure my constituents that we will not be returning to the staffing levels the CQC criticised in the past, having to deal with a deficit of nearly £21.9 million.
I can give that reassurance to the Honourable Lady. When I was in Hull a few months ago, I had a really fantastic series of conversations with clinicians, not just those who are leading the hospital, but clinicians on the front line in the wards, talking about how to address the particular staffing challenges that there are in Hull and East Yorkshire. It's about those tailored responses to problems of individual localities that means that we will get the kind of quality of service in Hull that she wants to see for her constituents, and I'm committed, as I know staff are in Hull, to ensuring that she sees it.
Mary Rimmer.
Thank you, Mr. Speaker. I'd like to ask the Minister to join me and visit the CCG and Whiston and St Helens Hospital Trust and the social services. The reason I ask is that St Helens and Whiston Hospital have just been rated good in 4 of the 5 and outstanding in care. The Chief Executive is now managing on the interim Southport Hospital to try and help there. She has previously worked at Warrington to do the same there to help them out of a problem. So we've no problem with our Chief Executive. Our staff are outstanding. They work hard. But they're having to recruit nurses from Spain. We have a wonderful working relationship between the CCG, the hospitals and adult social care and health. Lots of pooling going on. Nevertheless, Whiston is facing a £7 million deficit, and it isn't the PFI tariff that's doing it. It is the question, sorry. Please come and, would you please join me, come, and for a constructive discussion with these people to see what is happening on the face. I urge you to join me.
I thank the Honourable Lady. I know that my honourable friend, the Minister for Public Health, was in Whiston last year, and I plan to go back to Manchester. I was there a few weeks ago. I plan to go back to Manchester in the next few weeks, and the North West. And I'm going to be doing a regional tour, and I would very much like to meet her and talk to her Chief Executive. She raises an interesting point, actually, which is that the chief executives in many trusts across the NHS are really of exceptional quality, and it's very easy often to knock some of the managers in the NHS. There are some fantastic managers, and I'm sure that she has one in her constituency.
The region, I say to the Minister in all friendliness, is aware of the upcoming tour. It sounds a most exciting prospect. Mr. Barry Sherman.
Mr. Speaker, can I ask the Minister to think very carefully about what has happened up and down the country where health trusts like my own in Calderdale and Huddersfield were very successful, ran successfully for very many years, but only very recently, and I think it's something to do with the destabilisation of the clinical commissioning groups, that so much problems have been entered into the general life of the hospital trust. We in Huddersfield do not want the closure of A&E in our hospital. We don't want the closure of the main hospital and its replacement by a much smaller one. Will you look very carefully and forensically at what has happened in the Huddersfield and Calderdale area? And it isn't just a whipping boy of the unfortunate independent financial arrangement that was made, actually negotiated under John Major but signed under Tony Blair.
The honourable gentleman is an experienced member of Parliament, and he will know that there was a time when reorganisations and changes in the structure of the NHS and the way that hospitals were disposed was very much decided in Whitehall. And that has changed as a result of the 2012 Act. It is led by clinicians. And the changes to which he alludes, which we'll discuss tomorrow in Westminster Hall, are led by local clinicians, and ultimately the Secretary of State must defer to their opinion. There is an independent reconfiguration panel which judges them, and the Secretary of State so far has always concluded that the panel and the local clinicians have been correct. That's the right thing to do. So in this case, I hope that we will do the same. I expect that we will. But of course I will look very carefully at the individual concerns that he raises at the debate and make sure that I take them on board and relay them back to the CCG.
Liz McGuinness.
Thank you, Mr. Speaker. At Pennine Acute Hospitals Trust, which serves my constituency, A&E attendances are at a record high. The local paper this weekend carried the headline, "Stay away from A&E unless it's life or death." The Trust is predicting a deficit of £29 million by the end of the financial year. And whilst the staff work very hard in very difficult circumstances, does the Minister truly believe that this is an example of a successfully run NHS?
I say to the Honourable Lady that there are many, many examples of success in the NHS. And there are hospitals and CCGs and community health organisations delivering exceptional care within the existing budgets. And what we need to do is to make sure that we spread that practice, spread that approach to care across the NHS. There are some parts, I'm afraid, which are not doing that, and it's in that ability to level up, to universalise the best, as Bevan coined it, that we will ensure that everyone gets the level of care that those in the best areas in the NHS already receive.
Mr. Andrew Slaughter.
Thank you very much, Mr. Speaker. Last week, my hospital trust, Imperial, reported a £25 million deficit and announced a non-clinical vacancy freeze on top of 10% vacancy rates and above target use of agency staff. Their solution is to pay as chief executive £350,000 last year to oversee the downsizing of the major local hospital, Charing Cross. What is this other than a short-sighted and dangerous attempt to undermine the NHS?
Given the honourable gentleman's record of statements given to his constituents, whether it be a housing or hospitals, I have to say I would prefer very much the clinicians running Imperial than I do his own comments about this.
Mr. Christian Matheson.
Sir, on the one hand, we have the Secretary of State suggesting that he wants a 7-day-a-week NHS, which I presume is not an empty slogan. And on the other hand, we hear today that ministers are calling for headcount reductions, which suggests to me that we are asking fewer people in the NHS to work longer hours. Would the minister share my concern that that is a recipe for staff overstretch, for increased pressure on staff, and therefore potentially for greater failings for patients?
If the honourable gentleman didn't mischaracterise the situation, then he might have been able to ask a more coherent question. The fact is there was NHS Improvement that was looking for what savings could be made in back office functions within hospitals so that that money could be recycled into the front line. And all I can say to him is that the numbers of clinicians under this party have increased by 16,000 since 2010, and that is a record of which we are proud, and I know that we will continue to build on over the next few years.
Order.